Welcome, everyone. We'll give it a few seconds for Zoom to get its act together and let people into the room. All right, good morning. Thank you for joining us and welcome to our Colorado Health Institute's Eggheads webinar series for the month of August. I realize it's the first week of school and a busy time for many families. My kids just started a couple of days ago. So thanks for taking time to join us this week. Couple housekeeping items. We're recording the webinar, so if you have to leave or if you know somebody else who wants to watch it, it'll be on our website probably later today. You can use the, if you have questions, which we hope you do, or comments, even better, use the chat or Q&A functions on the bottom of your screen. We monitor both of them. We will try to ask you if you want to, if you do have a question, raise your hand, use that hand raise function in Zoom and come off, and then we'll identify you from the crowd and take you off mute and you can ask the question live. So with that, my name's Joe Hannell. I'm communications director at CHI. I've worked here nearly 10 years and also I serve on the legislative team, which is how I got involved in this local ballot project. We're really happy to be working with the Colorado Health Foundation on this, and we thought it presented a great opportunity to talk about local government. With that, I want to introduce Kyle Rojas Legleiter from the Colorado Health Foundation, where he's Senior Director of Public Policy, and we've worked really closely with him on the ballot tracker that you're about to see. So Kyle, thanks for joining us this morning.
Great, thank you so much, Joe, and thank you all to my fellow Eggheads for spending part of your morning during this busy back to school season with us this morning to talk about local level policy decisions that really impact what life on the ground looks like in different communities across Colorado. For those of you who aren't already familiar with the Colorado Health Foundation, just a quick about us. We are a nonprofit, nonpartisan organization that works across the entire state of Colorado towards a mission to improve the health of people in Colorado. And with health equity and racial justice as sort of the North Star that we really train our eyes to in everything that we do. And we take a really broad view of health and well-being and all the different components that factor into whether or not health is easily within reach for you, your family, your community, whatever part of Colorado you call home, or whether it might be difficult to reach for you and your family and in your community. And as we listen across the state of Colorado and the different corners of our state, we know that life does look different, depending on which part of Colorado you happen to call home. And sometimes those differences are factors or sort of consequences of local level policy decisions that are made by city councils, by county commissions, school districts, special districts in your part of Colorado. And sometimes those policy decisions are made directly by voters themselves through the mechanism of local level ballot measures. This is a really popular policymaking tool in the state of Colorado for a variety of reasons. One of which being that there are certain types of policy decisions that by provisions in our state constitution, by the sort of founding documents of your city, your town, your county, that are required to go to voters to approve those types of policy decisions and all that. So state legislature, your city council, your county commission, they're able to make really important, impactful decisions, but there's some things that are off the table for them without going to voters in their community and asking them and really directly putting the question towards them. So the Colorado Health Foundation had noticed this dynamic as we were really deeply engaging in communities across the state of Colorado. And we also heard across the state that this level of policymaking is really, really important, but really, really difficult to track and to monitor as well, both within your own community, whichever part of Colorado you happen to call home, but also have a sense of how is whatever you see on the ballot in your city and your county like or not like what your neighbors in the next county over might be seeing on their ballot and all that as well. So back in 2020, the Colorado Health Foundation took on a pretty ambitious project of trying to compile together in one place a one-stop shop of where you can find information about all the city and county level ballot measures facing Coloradans and voters in our states, regardless of where they live, in one place, because there was no one-stop shop for that information in Colorado before we really dug in, did some legwork, and tried to compile that information in hopefully an easy to use, easy to access and understand format where you can see it all together at once. That's now become an annual tradition for the Colorado Health Foundation, and we're excited for this year in 2023 to partner with the Colorado Health Institute in the first time as our partner in aggregating, monitoring, and piling together all of this information, hopefully an easy to read, easy to digest format for all of you to see a snapshot of not just what's happening presently in 2023 in local communities across Colorado, but also an archive of what that picture has looked like in 2022 and 2021 and 2020. So you can see sort of hot topics of today, but also start to track those trends, those patterns over time as well. We know that local level ballot measures are an enormous amount of work, regardless of which path they take to go before voters, whether that's a measure that's sort of initiated and sort of designed by voters themselves, where they petition to get it onto the ballot, or if it's something that a city council, a county commission might refer to their voters as well. There is a lot of thought and effort that goes into this policymaking process, and we're excited to have folks who can give you two examples of what that process looks like on the ground in their communities, sort of why they are taking on these ambitious endeavors in their communities, why they thought it was important. And we're excited to have that conversation with you today. So Joe, I'll turn it back over to you. And just note that I put the link for the ballot measure tracker into the chat for all of you. If you haven't looked at it yet this year, I encourage you to bookmark it. It is a live living document. So as more measures appear, sort of hit our radar, we are adding that in real time to that tracker. And as the status of these measures changes over time, we're updating that as well. So you can check back on it, for example, after Election Day in November, to see the fate of all these ballot measures that are going before voters this year in 2023. All right, Joe, back over to you.
All right. Hey, thanks so much, Kyle. So real quick about CHI, we're now in our 21st year. We're still here to serve the people of Colorado through providing research, strategic thinking, implementational know-how, and all the other services folks in the health field have come to count on us for. Today, I'm going to start off our presentation with a brief overview of the tracker itself and what it can teach us, or what we've learned from studying some of the trends in it, and what it will show us about Colorado voters and their preferences. Then we'll hear local stories from Larimer County and from Rocky Mountain Immigrant Advocacy Network. We're joined by Laura Walker and Brian Ferens from Larimer County. They're going to talk about their successful 2018 ballot campaign to raise money for mental health and the benefits their community is starting to see. We're also going to hear from Laura Lunn of Rocky Mountain Immigrant Advocacy Network. And they've secured local funding in Denver and Fort Collins for an immigration legal defense fund, which has some major implications for community health and health access, as she will discuss. But they did that without going to the local ballot. They worked through their elected policymakers, and we're having Laura here to kind of help put local policymaking into context, that to show there's a lot that can be done on the local level that does not involve a ballot campaign, and there's pros and cons to each approach. So she can help us weigh some of that thinking. And then we'll have plenty of time at the end for some discussion with everybody in attendance today. So first, why engage in local policymaking through the ballot or otherwise? There are a lot of good reasons. Kyle identified several. Here are four. First, there might be unique local issues. A group of Denver activists ran a campaign last year to build out the city's sidewalk network. I live near Sheridan Boulevard, just on the Lakewood side of Denver, and can tell you that is not it's not a pedestrian-friendly boulevard, and not as a result, not a healthy street, I would say. Second, there might be issues in your community that you just feel like are not being addressed adequately from the state or federal levels. And it's time for local government to take over. In the past few years, Larimer County and several others have decided to tackle mental health at the local level through the ballot. Third, you might want to raise revenue for something. And as Kyle alluded to, that the only way to do that in Colorado is through a vote of the people, because the Taxpayers' Bill of Rights amendment to the Constitution. So we had last year, Eagle Valley had they wanted to improve transit in the area, and they needed money for that. So they went to the voters and asked for a small sales tax increase, and they were successful in that. And then finally, there's just plain, it's just cheaper to run an issue on the local level than it is to spend $1 million or more that it takes to run a successful statewide campaign. So the tracker that the Health Foundation has a few purposes. It helps people figure out how to engage at the local level, if that's something that they're interested in doing, or maybe your group is interested in doing. Helps you figure out where in the state the action is. Helps you engage in a timely way, because we're trying to have some prospective information in there, so you can see not only what did happen, but what's coming up. And then what topics Colorado voters have been most likely to vote for in recent years. So we've done an analysis on the 2022 ballot measures, because those are all obviously in the past. We've come up with a few takeaways. The graphics I'm going to show you are all in some shape on the ballot tracker. So explore them. But first, what topics tend to be on the local ballot? Well, the biggest one is just general governance and voting. That's things like changes to the city charter, term limits, changing the election date. Finances also tends to be a big one. This includes tax increases as required under Tabor. And 10 years after legalization, marijuana is still a big topic on the local ballot, whether it should be legal, what its tax rate should be, all that. And then some topics come up in response to current events. I'd put housing in that category. We saw a lot of housing measures in 2022 for affordable housing, and often through levying a tax on short-term rentals like Airbnb. Then infrastructure also was a big category in 2022. A lot of that was in response to a recent state law that let cities take over and offer broadband internet services if their voters approve. So what do voters think about all these topics? Well, we've kind of broken out those categories and the success rate, and found that at the local level, at least in 2022, they tend to say yes more often than not. So if you run a financial ballot measure, and this includes tax increases, you've got a better than even chance of passing it. Affordable housing measures tended to be really popular. 3 out of 4 of them passed. The most popular one last year was parks and environment measures. There were 5 running around the state. Every single one of them passed. And then something that was, I don't know if it surprised me, but it's notable. The only thing that voters were against more often than not was marijuana. This included both legalization and tax increases for marijuana. I'd be curious to hear some theories on why that is. Maybe it's just that the more traditionally conservative jurisdictions are now running those legalization measures. Maybe voters are just kind of tired of dealing with marijuana after 10 years of policy debates about it. So this big spaghetti diagram is this looks at specifically taxes and what voters tend, what voters tend to approve or not when it comes to taxes. I know it's small, but we can go into, we can break it out a little bit more and look at, there were 26 measures last year that asked for taxes on like Airbnbs or VRBOs. And they all specify what they're going to use the tax for. So not only what the tax is on, but what it's for. And we see that ones that dedicate the tax for affordable housing are way more successful than anything else. In fact, only 4 that dedicated a tax for affordable housing failed. General government, not a little bit. It's a little bit more dicey that way. Public safety as well. Voters kind of identified Airbnbs and affordable housing as linked and decided that was a fair thing to do. So you can go through and check out all the different topics there. Let you do that at your leisure, or we can take a look at it during our Q&A period as well. Kyle already typed in put in the link, but here is how to, and another easy way to get there. Just go to coloradohealth.org, the foundation's webpage. Under their insights link, you'll see the local ballot measure tracker, and it'll load up, scroll on down, and we've got a few years of it on there for you to look at. So with that, I would love to turn it over to our friend from Larimer County. And I think, Laura, are you first?
I think so. So we could go ahead and pull up the PowerPoint. Thank you so much. And so I am Laura Walker, and I serve as the Health and Human Services Director for Larimer County. And that service area includes a behavioral health services department within. And that department was created through the ballot measure that was referenced at the beginning of the presentation in 2018. So if you want to go ahead to the next slide, I'll give a little bit of context of how we got here. So our county commissioners did attempt this ballot initiative 2 years prior to its actual passage in 2016. And you can see here the summary of that ballot initiative was a 25-year 0.25% countywide sales and use tax. And it was very narrowly defined to improve, maintain, and build a mental health detox and substance abuse facility to fill gaps in our service array in the county. And that did not pass. We think some of the reasons that we list out here that the ballot initiative was not successful then, it might have just been too long a time frame. 25 years sounds like an awful lot to taxpayers. We have a number of pockets, as every community does, of people who just really refuse to vote for any kind of new tax. And it was difficult to show people the value of such a narrowly defined facility and array of services when we really focus so much on detox and substance abuse treatment versus the full range of what behavioral health care needs look like. So go ahead to the next slide. So I'm going to hand this over to Brian Ferens. He is the Deputy Executive Director of the new facility that Larimer County is building as a result of getting these revenues in. And so he works with Summit Stone Health Partners, who is going to be the operator of this facility. But I would like him to talk a little bit about what happened between 2016 and 2018 that I think made the difference in the tax passing eventually.
Yeah, thanks, Laura. Thanks for having me and kicking us off. So I think the county was really committed when it failed in 2016 to getting more community partner support and getting some robust data to back up this ballot initiative and to show the community and to inform us of what the actual needs were in the community related to behavioral health services. And so the county already had a seat at a table of a local coalition called the Mental Health and Substance Use Alliance of Larimer County. And that group really took that project on in partnership with the county to work with a national consultant and really work together across the community to pull our local data, state data, federal data, and figure out what our problem was, what were the gaps that we needed to try and fill, and what would we be needing to pay for with the ballot initiative, the tax dollars. And so through that, a comprehensive needs assessment report was developed that had some key findings and key recommendations, one of which was that we were missing some really critical levels of care in Larimer County for behavioral health services. And so constructing a facility that I'll talk about here at the end of the presentation to capture and fill those gaps in our levels of care was really important, as well as utilizing funding for other community-based programs across Larimer County to build up our behavioral health services across the community was really important. And so if you want to go to the next slide, that all culminated into the development of a community master plan specific to behavioral health in Larimer County and led by the county. And so basically what we did is we took that needs assessment report and we took that community master plan, and the county, and along with other community partners, really went out and hit the streets and tried to share this information as broadly as possible across the community to help educate them on what the gaps were and what were we trying to solve with these dollars. And, not just looking at one level of care, but looking at overall prevalence of behavioral health and how could these dollars impact us being able to reduce that overall in our community. And so, yeah, the county and myself and a bunch of other community partners went and did town halls and spoke to hundreds of groups to kind of share. And then the county also sent out a survey to ask them about why they didn't vote, and then help share more information. So next slide. And I will pass it back over to Laura now to talk about the 2018 ballot initiative.
Thank you, Brian. So all that work that Brian described that our community came together to do did have a successful outcome in 2018. We did change the ballot initiative language. We shortened it from a 25-year initiative to a 20-year initiative, but the same tax rate. And you can see here that the ballot language was not restrictive to real focus on substance use disorder treatment, which again, we think had been a fault in the first go around of too much focus on that and not enough holistic approach. So the slide here says that the sales and use tax generates approximately 20 million. We've actually seen over the last couple of years an increase there, and we're getting closer to the between 23 million and 24 million dollars a year in those revenues to help us move this initiative forward. So go ahead to the next slide, because I want to talk a little bit about the other things that we've done in the last 4 years that we've had this tax, 5 years, that are separate from this acute care facility that we're going to focus on for the remainder of our presentation. So we knew that it would take time to build the facility that's going to be described in a few minutes here, but we had immediate needs in our community outside of just a facility to house a lot of these necessary services. And so we created a competitive grant process. We call it the Impact Fund, and had diverted between $1 million up to almost $3 million over the last few years, which if you go to the next slide, it'll outline how much we were giving out. We were very focused on the kinds of services that we wanted to either implement new or expand, because people had wait lists. Folks had trouble getting access to services. And so you can see here some of the categories that we targeted with these funds to make sure that providers could expand those services. So the next slide shows the actual dollar amounts. So you can see here in 2019, we started with a fairly modest pool of funds of $1 million, and that translated into 29 separate grants. And this year we're up to 2.8 million. And at this point, it's a little update. We're going to be bringing a recommendation to our Board of County Commissioners next week to fund 35 grants. So you can see there's been some variety there, but all those different providers are very targeted in addressing the needs of very specific populations within those guidelines, particularly around youth and the veteran population, and also people that are criminally justice involved. There's a lot of crossover there. So if you want to go ahead to the next slide, I'm going to hand it back to Brian. So really the capstone of our first phase of this initiative is coming to fruition at the end of this year. Brian and I were actually giving a tour to some community partners yesterday at this very facility that you see here on the screen. So I'm going to let him talk a little bit about the service array that's going to happen in this facility and where we're going next. Thanks, Brian.
Yeah, thanks. This is the acute care facility at the Longview campus that Larimer County has constructed and will be open for services in early December of this year. So you can go to the next slide. So as I mentioned, the comprehensive needs assessment report that was completed, one of the key findings was some critical levels of care that we were missing from our crisis services and our inpatient services in the community. So we had no withdrawal management, otherwise known as detox beds in Larimer County. So we were sending folks into other counties that needed withdrawal management care. And we didn't have enough capacity for our crisis. We have, much like all the communities that you all live in, we're sending folks to the emergency department unnecessarily, and folks are ending up in our criminal justice system unnecessarily. So the goal was to create a facility that could be as much of a no wrong door for crisis services as possible. So this acute care facility will open in December with a walk-in 24/7 behavioral health urgent care for anybody to come in a self-defined crisis and get assessed. We will have on-site care coordination. We will have crisis stabilization unit. We will have a withdrawal management or detox unit. We will have a 23-hour observation unit in the facility. We'll have on-site pharmacy, on-site lab. So again, we've tried to put as many levels of care into one facility so that we don't have to divert people and start something at the facility and send them somewhere else to get the treatment they need, or send them into another community. We're trying to do as much in-house so that our families in the community and clients know they can just come to the facility and we'll help them get the services they need. So we'll be opening with about 40 beds, which really increases our community capacity for crisis care in Larimer County. Right now, we only have a 10-bed facility in Fort Collins. And so this facility will serve all of Larimer County. And then future, we'll continue and expand. We have the ability to open up and operate 64 beds in the facility, thanks to the county. And so we'll be looking at future programming and future need as we open this facility and operate it for a while and see what the utilization, and we'll continue to work with the county to gauge what we're hearing from the community on what might we need to expand into for those other beds that we don't initially operate. So we're really excited to be opening this facility and offering this resource to the community. I think, next slide, I think that's the end of our presentation, and I'll pass it back over to Joe to then hand off to Laura.
Well, hey, thanks so much, both Laura and Brian. Just amazing work you and the community have done up there. A lot of takeaways from that for me that we'll talk about in about 5 minutes here. First, reminder that if you have questions or comments, drop them into the Q&A field or the chat, or actually don't be see a question already from Dawn Joyce. That can be our first one in a few minutes here. Also, don't be shy, hit that raise hand button, and then we can unmute you. Deani can find you in the crowd and unmute you, and you can ask the question live. So, but before that, as I promised before, I want to go to Laura Lund from Rocky Mountain Immigrant Advocacy Network to give us a little bit of a broader view of your options for local policy making.
Hi, thank you so much for having me. I'm really excited to share with you all what RMIAN has been working on with some of our partners to be able to expand access to legal counsel to non-citizens here in the state of Colorado. So on that note, let's start. So Rocky Mountain Immigrant Advocacy Network, or RMIAN, is a 501c3 nonprofit organization. We've been around for almost 25 years now. We started working in this immigration detention facility featured in the slide that's in Aurora, and we've expanded our services beyond that. So next slide. Part of what we do is provide Know Your Rights presentations, both at the detention facility in Aurora, as well as at the Denver Immigration Court, so that we can try and capture as many people as possible in the state of Colorado who are in immigration removal proceedings, so that we can provide them with basic information about their rights and responsibilities in the immigration process, and to make sure that they know what forms of legal relief may or may not be available to them. We provide direct legal representation to a fraction of the people that have a need. And if you can go back to the last slide, please. That's no cost legal representation. So again, we're a nonprofit organization. We don't take any money for our legal services. Part of what we're doing is trying to advance the concept of universal representation, which I'll talk about a little bit more in a moment. But that is essentially a public defender system for people in immigration removal proceedings. And one of our main advocacy touch points is trying to end immigration detention. And I'll talk more about why in another moment. Next slide. So who is it that we serve? I'm pleased to present some of the folks that we have been able to meet over the years. The first is a mother and daughter. So we represent family units who are in immigration court proceedings. We recognize that they have been targeted by immigration policies disproportionately and channeled through the system as quickly as possible. And so as a result of that, they are one of the more vulnerable populations within our immigration system. In the middle is me with one of my former clients who was separated during President Trump's family separation policy from her 5-year-old son. And so this was the day, that's the detention facility right behind her. This is the day that she was released from custody. And it was just the first step to being reunited with her son. The next person over here is an unaccompanied minor who just got his green card in this photograph. So we serve kids who come to the United States all by themselves, really young children. No one is afforded legal counsel in immigration proceedings. So unless RMIAN was able to serve this child, he would have had to represent himself in immigration court. The two gentlemen hugging on the bottom are the man in the beige is a former client of ours who was detained for many years before we ultimately won his case. And this is him being reunited with his brother after not seeing him for years. Again, I want to highlight that immigration detention is civil detention. So no one is being held on any type of criminal charge. This is all just so that they can process their immigration cases. Finally, the young woman with the Denver volleyball t-shirt is a DACA client of ours. So deferred action for childhood arrivals is a policy that President Obama advanced to make sure that immigrant youth in the United States would have access to a work permit to be able to function in our society. And that's her attorney next to her after she was just granted her DACA status. Next slide. So as I mentioned, universal representation is this concept of making sure that everybody in immigration court has an attorney by their side. And there are many reasons why this is advantageous. I would say right now, the current model of immigration legal service providers is kind of a triage model where you pick and choose and you try and serve the people who you think have the best chance of winning, or who you think wouldn't win without counsel. But a universal representation model doesn't look at the merits of anybody's case. What it does is it looks to see if somebody needs an attorney, and then you just give an attorney to everybody. That's the whole idea, to make sure that you're not picking and choosing, and that promotes racial equity, because in a system where people pick and choose, you might select one person over another for all kinds of either overt or latent biases. And so this is a mechanism to make sure that there is more racial equity, particularly knowing that people who have contact with the criminal legal system are disproportionately criminalized when they're people of color. So just to kind of contextualize this, only 12% of people in immigration proceedings in the state of Colorado had an attorney by their side in the past year, looking at recent arrivals. So there's a great need, and we're very, very far from being able to offer true universal representation to everybody, but we're certainly on our pathway there. So next slide. So in 2016, as we all know, President Trump was elected into office. And in 2017, as a response to that, local community members really galvanized to make sure that there were protections for immigrants in our communities. And so Mayor Hancock in the city of Denver issued an executive order creating the Denver Immigrant Legal Services Fund. So that was the first universal representation fund in the state of Colorado. And it started out very small and incrementally has grown, but we have to go to lawmakers in order to get that money infused into the system, which is a very different model than what Larimer County was just describing, right? Fort Collins passed an ordinance through their city council in 2021, and that created the Fort Collins Immigration Legal Fund, and that again funds people from the Fort Collins area who have immigration matters pending. Finally, in 2021, the Colorado legislature passed House Bill 21-1194. Again, that created an immigration legal defense fund to try and strive toward universal representation. The initial fund was only $100,000, which, to contextualize that, funds about one attorney, which is certainly not enough to meet the need that I was just describing, especially when there's about 36,000 pending cases here in the state of Colorado. But it certainly started us on our way. Next slide. So just to kind of recap, ballot initiatives obviously are the most pure form of democracy, where the voters are directly endorsing whatever change you're trying to make. With Denver, we went to the mayor's office. Denver is kind of uniquely positioned. My understanding is that the mayor in Denver has a disproportionate amount of power compared to a lot of other cities, just by the way that things are structured. but that could be advantageous if you're trying to quickly move something forward, like I'm describing in terms of the response to a more hostile executive branch, making sure that local communities can really set the precedent for how they want people to be treated within the community and what kind of services they want to make sure that they have access to, despite what might be happening on a federal level. And then city council ordinance is kind of somewhere in between, right? Where members of city council have been voted into office by the community, and you need to be able to get them to agree to pass an ordinance like the one that Fort Collins passed. Next slide. So as I mentioned earlier, RMIAN advocates to abolish civil immigration detention for many, many reasons. But one of them is the poor access to healthcare, which as a result has led to the deaths of many people in immigration custody. Just last October, Melvin Galera Mendoza died in the Aurora facility of a pulmonary embolism. It seems as though it went untreated, and that is the reason that or at least one of the reasons that he passed away. And just 5 years before that, tying back to what Larimer County was talking about, one of the people detained in the Aurora facility had a methadone dependency, and the nurses at the facility kind of did an inappropriate detox that was not recommended for that was not the standard of care, I should say. And he passed away at the Aurora facility. So we're seeing how this presents in our own community. And RMIAN has filed countless complaints against the Aurora facility for inadequate medical care. And so access to counsel allows us to do that, because if our clients did not have an attorney by their side, they would not have this kind of outlet to be able to complain about the conditions of their confinement. Next slide. Okay, so again, this is the Aurora Processing Center that is privately owned by Geo Group, but they detain people for ICE, Immigration and Customs Enforcement. As I was mentioning, RMIAN has seen time and time again the ways in which people do not have adequate medical care, and then how it negatively impacts them while they're detained. So RMIAN worked with Denver Health to create a medical legal partnership to fill that gap, to make sure that we had a pathway where we could channel our clients to make sure they had access to forensic psychological evaluations or physical evaluations, which not only helps them gain access to medical care, but also helps them with litigating their immigration cases. Next slide. Can we go back one slide? Thank you. So part of what's so incredible about this partnership is that a lot of our clients have not had access to medical care before, or certainly not the level of care that's available here in the Denver metro area. And so they're able to get diagnosed for the first time. They're able to get access to all kinds of medical care that they never had. And on top of that, in terms of having a continuum of care, we have social workers at the Rocky Mountain Immigrant Advocacy Network, where they're able to make sure that once people are released from detention, they're able to access medical care as well. And they also work with our families and children to make sure that they also know how to access care within the community. So again, having an attorney is another touch point to having a social worker, is another touch point to being able to gain access to medical care. And not only that, but it's helpful in immigration cases. So looking at asylum claims, which is the vast majority of cases that we work with, is people fleeing persecution or torture in their home countries. When you look at the outcomes in cases where a psychological or physical evaluation was presented, 89% of people were granted asylum, compared with only 37.5% of people who did not receive any type of medical care and was not able to present that as evidence in their immigration proceedings. Next slide. So what we're really promoting is this theory of change, where we think that universal representation is going to promote fundamental fairness and due process in the immigration court proceedings. In fact, people with counsel are 10.5 times more likely to win their immigration case. And so we know that if somebody has a benefit available to them, they should be able to gain access to that benefit. And so that is what an attorney helps to do in immigration proceedings, which have been compared to the tax code in complexity. So imagine not being able to speak English, not having any type of formal education, and being charged with representing yourself in an immigration matter, where 100% of the time, immigration and customs enforcement is represented by an attorney. So because there's this like huge imbalance in the court system, that's why we see so many, such a large gap between the different outcomes. And as I mentioned, having access to counsel creates a pathway not only to legal benefits, but to all kinds of social benefits, such as medical care, stable housing, and things like that, to make sure that people are able to be productive and valuable members of our society, and not bogged down by all of these other issues that they have related to their immigration cases. In terms of what's next for universal representation in Colorado, we're continuing to fight for more funding. As I've mentioned, the amount of funding is just not adequate to be able to really make a meaningful dent in the problem. And so it's actually been really helpful talking during the course of preparing for this presentation to really think through whether or not local ballot initiatives might be the next step for this campaign. So on that note, I will pass it back to Joe.
Well, thank you so much, Laura. As always with these seminars, I'm learning so much about, well, a variety of things. I'll mention medical legal partnerships are, what great results that you've proven that these work, and it's not a common thing. You're one of the only ones in the country that we know of, I think is what you told me. So definitely something I would love to explore a little bit more. We do have time for Q&A, and we have again, if you'd like, please raise your hand, use that raise hand function. We already have a few questions though. Two for Larimer County that I'll serve up at the same time. First, Dawn Joyce. Hi, Dawn. Thanks for joining us. She asked what ages are served by the facility that's going to open in December. And then another question in the Q&A. How did you at Larimer County come to the conclusion that a local tax was the best way to address needs in your community? Were there a lot of conversations beforehand to decide if a ballot initiative on a tax was the best way to pursue this?
I think I'll let Brian answer the ages of patients that we're going to be seeing at the facility first, and then I can take the second one.
Sure, yeah. So through our walk-in urgent care, we serve the lifespan. So we can serve any age in our urgent care and assess and screen and triage, as well as in our 23-hour observation unit. But our detox unit and crisis units is 18 and older per our licensure with the state. So, but I don't know, Laura, if you wanted to mention potentially some future solutions for some adolescent support.
Yeah, thank you. So Brian's correct that we've always had a longer term plan set out in phases for the 20 years worth of the revenues that we expect. And phase 2 is going to include some additional services for our youth, because we know that that's a significant gap. And we're envisioning leveraging the services and the capacity that are going to exist at the acute care facility that's already complete, but probably building another building so that we have some separation and a whole different array of services for youth at that point. So, and then getting to the other question about why a ballot initiative we thought was the right way to go. We did look at a lot of different options for how these services can get supported. We looked across the country for other models where communities were doing a better job of meeting those kinds of needs without sending people across the state or into other locations, taking them out of their communities, or just not having the services, period. And so unfortunately, we did not find a lot of other models where this is working. And knowing that the limitations of massive programs like Medicaid and Medicare, the limitations, because there's not parity at this point between physical health and behavioral health, especially when it comes to insurance coverages, whether you're talking about those public programs or private insurance. And so our commissioners just really thought through and said, you know, if our community can understand this problem, then maybe a very small sales tax increase in the grand scheme of what people are spending on in our community might be the answer to have something sustainable. And hopefully these other insurance programs will catch up in the next 20 years. And that's really the hope, is that the sustainability might be there naturally without having to continually fund it with other local dollars.
All right. Hey, great. A really good question in the Q&A here. The questioner asks, interested to hear that the local tax increases are passing at greater than 50% rate, while statewide tax increases tend to fail in almost all cases. And we've looked at this, and it's like Colorado voters will put taxes on tobacco and marijuana, but very little else. In fact, I think the school lunch initiative was one of the first statewide successful tax increases. In fact, the Colorado vote, our questioner says Colorado voters are more likely to pass an income tax decrease. Any thoughts on why this might be? I'll throw it open to whoever might have an ideas on how to answer that.
Well, I can say just from our experience on this particular ballot initiative, it was so difficult to have the capacity to really reach enough voters and educate them about the issue. I can't even imagine trying to take this same topic statewide, because the amount of capacity you would have to put towards the level of education that we needed to go from a failure to a pass 2 years later was immense. It was an immense lift. So that's just a piece from the local perspective for me.
Yeah, and I'll jump in here and add that, you know, a ballot measure campaign is a difficult thing to put together in general. And I noted this in the chat a moment ago. The Colorado Health Foundation commissioned a series of case studies after the 2016 ballot measure cycle, where we interviewed a handful of state level ballot measure campaigns as well as local level ballot measure campaigns, including the 2016 campaign in Larimer County that our other panelists talked about. And just sort of ask them, you know, why did you go to the ballot, and what did you learn along the way about what it takes to run a successful campaign, and what lessons would you advise to your future selves, you know, if you wanted to go down this pathway again. So it's a really interesting read, and I encourage folks to look at that. But to the question about tax increases, one of the really consistent things that we see in public polling, both in Colorado and across the country generally, is that folks tend to trust the level of government that they are closest to. So if you ask people to rate their feelings about the federal level of government, they tend to be fairly low. The state level, a little bit higher, and then local level institutions, generally speaking, are the ones that voters tend to trust the most. So maybe sort of a reflection of, like, I trust the institutions that would ultimately be in charge of operating and implementing whatever tax increase, whatever those funds would go to, a little bit more than I tend to trust state government or federal government, because it feels closer to home. And one of the sort of pieces of skepticism that we often hear across communities when it comes to state level tax policy questions is, you know, if there was more money for something to go around in Colorado, whether that's transportation, infrastructure of other types, healthcare services, all those kinds of things that you might want to pursue a tax increase for, some skepticism of, like, well, I actually see an impact of that in my particular community, where folks have a little bit more confidence about that when it's, you know, confined to their local government seeking a tax increase compared to the state of Colorado writ large.
Yeah, excellent points, Kyle. I'd concur on the local people trusting the government that's closest to them. You know, often you can see city council members in the grocery store or something, just they're there in the community. We still have time for a few more questions. There is none right now, which gives me a chance to ask one that I've been wanting to ask. Does local policymaking and raising resources like this, does that raise the risk of inequities across our communities? You know, Larimer County is you know, it's a pretty well capitalized county. We've got a major research university, major employers. You can raise $20 million a year through a relatively small tax. Got the staff to do this huge lift that you did to figure out what voters would respond to. I can hear right now folks from some rural counties, probably some where a lot more of the voters are skeptical of government. What can they do? And are we at risk of having or of exacerbating, I would say, the urban rural inequities that we see? What's anybody think of that?
Yes, I definitely agree that when resource-rich communities like ours, even though we had gaps in services and people not getting proper access, I realize we're a lot different than the San Luis Valley when it comes to access. And for me, you know, coming up through the you know, local system for human services and how much our state partners play a role in the equity of services like Medicaid eligible services, child welfare services across the state. I think what's really important is that when these smaller communities are seeing what's happening, you know, 50 miles away from them, that's really changing access for a community, they need to be talking to our state partners, because if the Behavioral Health Administration at the state level was providing additional funding, we might not have had to run a tax measure. You know, so there really are some statewide mechanisms to improve some of these systems and some of this access. And rather than, you know, focusing on how do we get a local ballot initiative, because in the San Luis Valley, you're still not going to raise enough money to build a building like we did, even at the same tax rate. And I realize that. So some of this has to be leveraged on statewide systems that have the capacity to reach all the regions.
So I think the takeaway from all this is that local policymaking, the local ballot, it's a crucial piece of the puzzle, but it's not the whole thing. It's not, you can have some real success there. The past proves that there's some great odds of success there, but we have to think at all levels when we're talking about addressing some of these pressing issues that have just come to a head here in Colorado, such as our legal rights for especially for people of color, such as mental health, housing, could name many others. Thanks so much, everybody, for joining us. We'll have the recording posted later this afternoon, and we'll have an announcement in a week or so about our September Eggheads webinar. So thanks a lot, especially to all of our guests today, Laura, Brian, Kyle. Thanks for being here. Take care, all. Have a great school year.